because I don't want to move it along, but I also don't want to stop the meeting on this.
Right.
Because we are very time sensitive.
So are there any other,
I could find nothing else.
That's all I.
okay. Then we'll entertain a motion on the minutes as submitted.
I'll make a motion in regards to the approval of the minutes from February 18, 2020. The Board of Health approves the minutes.
Second.
Okay, motion has been made and seconded. Is there any further discussion? All in favor? Aye.
Aye.
Okay, 4-0-0. We have a septic variance at Charles Gate Road.
Say a few words, just so then he doesn't need to sit through the rest of the meeting.
Sorry, what was that, Melissa?
We're just gonna have Patrick jump in.
Oh,
with just
okay,
a
sure.
COVID-19
Yes, oh,
update.
absolutely. Yes. Let's do that. Let's defer any action. We'll love to hear from Patrick. Go ahead, Pat.
Great, thanks, Mr. Chairman, and thanks to the board. I know that the town administrator had provided an update to the board last week. However, there wasn't a quorum. So there's a lot that's actually happened in the course of the past week. So I appreciate the time that your board's giving to administration. So Jim's he's just finishing up a selectmen's meeting, so he isn't able to participate in this meeting himself. But there are a few things I just wanted to keep your board up to date on. So. Melissa's obviously going to give an update on what the health department's been up to. But on the administrative side of things, I think Jim mentioned last week that on March 13th, he implemented a budget freeze in all non-emergency related expenses on each department budget across town until we can get an idea of exactly what we're dealing with as it relates to the COVID-19. On March 15th, the town administrator, Melissa, it's the health director, the two chiefs, and the DPW director, they declared a state of emergency in Walpole. And what that enables us to do is, it allows us to move money around as an emergency response. In addition to that, the town administrator made the decision to close all town buildings to the public, including the police and fire station. So just yesterday, you may be aware that the governor issued an emergency advisory for all non-essential businesses across Massachusetts. Some of those advisories apply to town departments as well. So going forward, we've got a skeleton staff working at town hall, no more than one person for each office, with certain exceptions. But then, in addition to that, we've made additional resources available to the public to keep them in the loop as far as what we're doing here. We have a pretty active coronavirus webpage you may have seen on the town's website, www.walpole-ma.gov/COVID-19. We have a ramped up Town of Walpole Twitter account, and I know that Trish has her own Twitter account that she's been using to, I think, public nurse or health nurse or some combination of that, Trish. Jim's been doing regular PSAs to keep the public informed, and those have been displayed in Walpole media. We've been working really closely with the food pantry to make sure that the food that families continue to receive food. Another food pantry have been working closely with the health department as far as families being able to go into their facility on Washington Street. So we've reorganized that so it's more of a distribution going to households. So as many as 80 deliveries were made today with the assistance of town staff and the Medical Reserve Corps, which is overseen, of course, by the health department. And again, just utilizing Walpole Media. So just a couple other quick updates, of course, in accordance with the governor's earlier order, all public schools in Massachusetts are closed until April 6th. Starting last week, students started to receive an increase in communication from teachers and parents, from teachers and school staff, In the meantime, custodians have been working on disinfecting all the buildings and then closing them to the public until further notice. The police and fire departments, they've been taking steps to ensure that the public safety continues to be maintained. Both police and fire stations have been closed to the public until further notice. The police department has been circulating new policies, procedures, and general orders to ensure a safe response to COVID-19. And then the fire department, Chief Bailey, was just updating the Board of Selectmen that they've activated Station 2, which is the station in East Walpole, as an effort to separate the fire department until further notice. Last week, the building department issued an order to temporarily cease all construction projects. We anticipate that this is probably going to change in light of the governor's order yesterday. He's identified construction as one of the essential services to support COVID-19. In his press conference today, he mentioned that there's going to be a guidance coming out from the state, cities and towns about how to deal with construction. So we anticipate this guidance tomorrow, and once we get that guidance, we'll work with the building commissioner's office to make sure that our our construction projects are in accordance with kind of the state standard. So just kind of close it all off, I just want to recognize the health department for their outstanding work and professionalism these last few weeks. This definitely hasn't been an easy last few weeks, but they've got a great team with Melissa and Rika and Trish and Jen Nordbeck, who just started, just kind of thrown into the fire. But fortunately, she came from the building department, so she's got some experience with regulatory department and inspections, and she knows the town of Walpole standards as far as ensuring public safety and public health. So that's really the update for me. I'm happy to open it up to any questions. I know you're kind of on a short time frame with the Zoom account, but happy to turn it open to any questions you have.
Let me say, first of all, Patrick, thank you so much for the update. And I have visited the website, and I think you guys are doing a fantastic job in terms of keeping the town updated and informed as to what's going on. So just continue to do that. This is obviously an unprecedented time, and I think everyone is really stepping up and doing everything that is humanly possible. So kudos to you and to Jim and to the entire town staff on that.
Great, thank you very much.
Thank you, Bill. I couldn't agree more. I think it's definitely like an all hands on deck approach. I feel like the town of Walpole's definitely come together as a community, and just the town employees, everyone's kind of on the same page, everyone's helping each other out. I'll just talk really quickly about kind of COVID-19 updates. So as you know, the big elephant in the room is we had about 2 weeks of 0 cases, and then last week we finally got our case. So we ended up getting 2 cases, and then over the last few days, so today we're at the number 8. And I only anticipated actually getting larger the number. I heard today that they did about 370,000 tests within the United States. Within the last week, they've actually conducted 220,000 of those tests. So it's just now tests are being done, results will be coming in. It's definitely, they have a backlog of obviously tests that they didn't complete the results yet on. So I think they'll get a better gauge, because right now I think the results that are coming in are skewing what's actively out there. Once they catch up, then they'll have a better gauge on cases within 24 hours, and that way we can kind of see where we're at with flattening the curve. Like Patrick touched upon what the governor's addressed yesterday, I think it will obviously limit the amount of people that are out and about and hopefully limit the contact. There is a list, which Patrick mentioned, about essential businesses. It's kind of a long list. So we've been just fielding questions from businesses throughout the community asking, do I fall into the criteria? And we just decide, does it or does it not? And obviously give the best information. We were made aware yesterday by the state that the vape stores do not fall under essential. And I actually just got a phone call from the police right before getting on the phone saying that they did have Vape City was open today. They did close their doors though voluntarily when it was brought to their attention, and we'll look for guidance from the health department. So I'll reach out to them tonight via email to let them know that they cannot be open. We did receive funding, so we should hopefully get a check in the mail next week from Human Health Services, which will help with any surveillance overload. Obviously, every case requires an investigation. Depending on how many people were considered a contact. Trish, who has been doing an amazing job, reaches out to these individuals and kind of does a background of who they've been in contact with to obviously stop contact and the virus spreading. So I'll segue into Trish. I know we only have a small amount of time because we do have a rather large agenda, but just to kind of, again, give a huge kudos to my staff because we're killing it, and I feel like everyone's just doing an amazing job. Like Patrick mentioned, Jen Nordbeck, she was going to be on the call, but then when everything got messed up, I wasn't able to get the information when it changed. So she will be on our next call. So she took over for Mary's staff assistant position. She did come from the building department, so I think it's a really good collaboration because she does a lot with housing and similar questions that we would have in the health department, she's already fielded. She's jumped in like full throttle. I really think she should be running from the building at this point with all the issues that we do have, but she's very, very active and very on board and excited to be a part of the team. So we'll make sure she's on the next Board of Health conference call.
Yes, Trish, what do you have for us?
So just real quick, like Melissa mentioned, we're up to 8 positive COVID-19 cases, but thankfully, so far, everybody's been really compliant. The limited number of contacts is really just household contacts, which has been good. It's really helped over the past couple of weeks that people have been ordered to work from home. A good majority of them are retired. It's just themselves and maybe 1 or 2 other people in their homes. And when symptoms started, there's just so much information out there that people know once those symptoms started, they've kind of hunkered down, stayed in. So it's really kept the list of contacts to the positive cases very manageable. So far it's been really good. And like Melissa said, I just feel that now the cases will be coming in a little bit quicker because a lot of labs are using the electronic lab reporting system. Automatically gets generated into Maven, which gets put out to me. So we're gonna fortunately keep coming pretty quick. But so far it's been good. Everybody's been super responsive and really easy to kind of keep a handle on everything.
I mean, other than my wife, I haven't had any human contact with anybody in like a week. It's really strange. Yes, obviously keep us all updated on all of that.
Hello, can you hear me?
Yep.
I have a question. Now, all these cases have been ordered to be quarantined or any hospitalization?
So far, everybody's been in isolation, and just one gentleman I talked to today was actually in Norwood Hospital. He was admitted for, ended up with about 2 days because he had the complication of pneumonia as well. So they kept him in, did the chest x-rays, got the COVID-19 testing back, which was positive, but they had already put all of their procedures in place. So when I talked to the infection preventist over at Norwood, she said there wasn't any concern on their end. And he's actually a gentleman that lives by himself. So that's the only one so far that's been hospitalized.
Do we have an age range, Trish?
Yeah, so right now my youngest is 20 and my oldest is 71. I have a few that are in between 40s. I have 50, 53, 60, 61. I have a 27-year-old. So it's
all over the place.
Yeah, it really is. And the symptoms are all pretty standard. It's the fever, congestion. The thing that's concerning is some have a cough, some don't necessarily get a cough at all with it. Body aches, fatigue. Those are kind of my biggest symptoms.
Wow.
Body aches and fatigue. Okay.
Yeah.
Have you run into anybody with trouble with smell or taste?
You know, I haven't, and I've heard that's one of the early symptoms. But so far, when I've been asking, I haven't had anybody that's had that those symptoms yet.
Interesting.
Yeah.
Yeah, because I was just reading an article today that was one of the precursors for actually coming down with symptoms, was losing the sense of smell, certainly, and then possibly sense of taste.
Right.
It's reversible, which is good news.
That is good.
Okay.
All right.
I mean, obviously, given the time constraints we're under, are there things on our agenda that we absolutely have to deal with tonight?
So I would say do the septic variance just to get that out of the way. Again, I don't really know necessarily if they'll be installing anything, but at least I think that's an easy one to go through.
The Charles Gate one?
Yes, and then I would say if we could possibly jump down to the new business and cover 1, 2, and 3 there.
Okay. All right, well, they're looking for a local upgrade at Charles Gate to allow the soil absorption system without the perk test. That's a pretty standard one. Are there any specific issues with that, or should we just go ahead and approve that?
No issues with that. The plan has already been approved by our office, so we don't see any concerns.
Okay, then I'll make a motion regarding the septic variance at 16 Charles Gate Road, that the Board of Health has no issues with the requested variance.
I'll second that.
Second.
Okay, we have a motion and seconded. Is there further discussion? All in favor? Aye.
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 All right, I hear 4 ayes, so it's 4-0-0 on that.
So we
All
have
right,
5
folks,
of
I'm
us
gonna
on.
jump off for the night. Have a good
Thank
night.
you,
Have a great
Patrick.
meeting. Thanks, everybody.
Thank you,
you.
Patrick. Continue all the good work. Much appreciated.
Thank you very much. You too.
I think
Thanks.
it's 5 because we have all 5 board members on.
Oh, we do? Okay, 5-0-0.
Yeah.
Great. So we want to jump down to what?
So I would jump down to new business. So on the new agenda that you guys have, if you received it, it's numbers 1, 2, and 3
Yeah.
from the agenda, the 24th. So Rika, I'll let you jump in here.
Okay, so just coming in, so it goes over the different risk categories for food establishments, and Walpole already had something similar in place that you approved in 2017, but since Massachusetts and Walpole then as well adopted a newer food code, the 2013 food code at the end of 2018, I wanted to update those risk categories to fit the updated language and the updated FDA requirements, or I guess they're not requirements, but they're goals for regulatory bodies that they would like us to meet. So what you should have in front of you is just the different risk categories 1 through 4, what meets that, like what type of food establishment would fall under each risk category, and then depending on that risk category, it determines the frequency of inspection, right? Because a low risk establishment doesn't need to be inspected as frequently as a higher risk food establishment. And then it also allows room, which again, Walpole already had in place, but it's just updating the language a little bit to reflect the newer food code. But if there is an establishment that has a history of non-compliance or not active managerial control, then you can increase their risk category, so increase the number of inspections that they have per year. And this is routine inspection, so that doesn't include re-inspection. So what we do is we go do a routine inspection, and then if there's violations, we go back out to do a re-inspection. So this would just be for number of routine inspections, and then the number of re-inspections vary as needed.
Okay.
So my question is, because of the number of inspections that you need to do on these establishments, depending on their risk category, is their permit up? Do they have to spend more money on their permit?
No, so their permit will remain the same. It's just kind of to give us better guidance. So this is something like Rika mentioned, we already had in place. Robin and I did it in 2017 and it went in front of the board. The only difference is the language changed because we recently adopted the 2013 food code. So it's pretty much on the same premise of those having critical repeat violations will be inspected more frequently than those that have good inspection reports.
But also to add to that, I mean, generally, like the size of it, so a retail establishment, like a gas station that maybe just has a few refrigerated products, that food permit already is less because it's a retail food versus like a food establishment that serves food. So in some way, the risk category is reflected in the cost of the permit, but it doesn't necessarily determine that. But generally, like a full service restaurant that might be at a higher risk category, like a category 3, they're generally going to be a larger food establishment, so their permit fee will be higher.
Okay, that makes sense.
So do we need to entertain a motion for that, or this is just an update?
No, I think it's just an update. I don't think we need to do anything specific on that, do we?
I think you guys can make a motion because technically we're changing our whole, well, not really changing it, but we're just kind of adopting how our risk categories are based. And this is a document that we'll use to base our inspections off of. So I think
Okay.
as long as you guys are in approving of it, I would say make a motion to approve it.
All right, who'd like to make that motion?
I'll make a motion in regard to the risk-based inspection reporting update for the town of Walpole, the Board of Health approves the update.
Okay.
I'll second that.
All right, I hear a second. Is there further discussion?
Carol. Okay.
All in favor? Aye.
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 5-0-0 on that. Coalition for
No, so that's the, so then,
meeting
yeah.
tonight, which obviously I don't think is happening, or?
so the new one, the new agenda had number 2 as the update for the new fee schedule, which is number 2 on new business. It should be on your agenda.
Right,
Oh, okay, yeah.
right.
Yep. For
Okay,
the,
so Rita, do you want?
Yeah, so this
Taking
just,
this one. Sorry, no, I'll take this one.
oh, okay.
No, sorry.
I did see the new fees and they looked.
So it's kind of what we talked about maybe like a month ago with our Board of Health meeting. So we took everyone's comments into consideration. Obviously, at the time, we did not have a residential permit. So what it was is they were considered just like a small food establishment, so it was $200.
Right.
So I know Carol had a point where she was saying she feels the residentials are paying the same amount as a food establishment is paying. So Rika did a lot of back work to see what other communities have for fee schedules. So if you look at the sheet that you have, it says what we currently have in place and what we're looking to implement. So residential, we normally had a $200 permit fee. So we're looking to make that actually $75. And again, that would just be residential kitchens. Right now, we have about 4 residential kitchens in Walpole. Currently, we do not have a farmer's market permit in queue, so we would like to implement a fee for the farmer's market. So it would be $50. At this very moment, we would charge them what's called like a seasonal food permit, which would be good for the whole farmer's market season, and that would be $75. So it is lowering the cost for that. And then for seasonal, we did increase it because at the time our seasonal food permit was $75, which was the same as our temporary, which was, you know, seasonal was 4 months or so, and temporary was anywhere from 1 to 3 days.
Right.
So we did increase that by $50, and then we broke down the temporary food permits into one event would be $75, 2 to 3 events would be $150, and 4 to 6 events would be $250. Felt like this was pretty reasonable, and also bringing enough revenue in to pay for any inspections that would need to be done for these events. So I don't know. Sure. So the farmers market would be if they had any food requiring a food permit through our office, they would pay $50, and that would be for the season.
I
think so, and we definitely took into consideration we didn't want to lose money, obviously, so we kind of factored in that this would be the best where we think it's very fair and also, again, covers the cost of our inspectors to go out.
Fair. I don't know.
I mean, it seems fairly reasonable, all things considered.
Correct.
I don't have any specific objections, but, you know, obviously, are there other board members that have any comments on the proposed schedule?
It seems a little arbitrary. But
Okay.
I don't do these inspections, so I don't have a good sense for how much effort is involved in each one.
So I just also, I know Melissa had mentioned, I also did like a whole chart and looked at communities surrounding Walpole to see what type of different permits that they issue for food establishments, what their fees are. So we did try to like kind of fall in the middle of those. Some were a lot more expensive, some were lower. So we tried to follow more like middle of the road. And then we do have contractors that do food inspections, and I believe it's $75 per inspection.
Yes. And then they charge, it's about $36 for a re-inspection. So again,
Okay.
covering the costs without losing money.
Mm-hmm.
The chart you made up available for anybody to come in and see? Once the office is open, of course.
Oh yeah, of course.
Good. Good. I'd love to see that.
So, the residential.
But I like what you've done.
Sorry. So I just had a question about the residential permit. Does that cover the catering business? Like,
So no, that's just like if someone has a residential kitchen in their home kitchen. It's not like a commercial kitchen. No.
oh, okay. So this applies to every single new house in.
Correct. If someone's they're dealing with non-potentially hazardous foods and they're looking for a food permit to have a residential kitchen within their home.
Oh, okay.
So if someone wants to bake cookies and sell them and do it out of their house, that would be a residential food permit.
Yeah, you won't need a food permit just to have a kitchen in your house, I don't think.
Right.
Although that might not be a bad idea.
We'll add that to next week's agenda.
So much for lemonade.
So is there any other discussion on the fee schedule update?
You need a motion on that?
We would definitely want a
We will.
motion for that. Yes.
Do we need to introduce?
I'd be happy to make a motion.
Carol?
Should I make one?
Of course.
Yes, please
I'd
do.
like to make a motion regarding the updates on the food fee schedule. The Board of Health is in full compliance and agreement with the new schedule.
Okay, do I hear a second?
I will second it.
Motion has been made and seconded. Is there further discussion? All in favor? Aye.
Uh,
Aye.
Aye.
500 on the new fee schedule. All right.
The last real pressing issue, because then we'll try to discuss our next meeting time, is just John Spillane is interested in being nominated another year for his
absolutely,
animal
yes.
inspector. So we just want to make a motion that we support that. And then I'll fill out the paperwork.
Okay.
so moved.
Motion.
Motion's been made. Do I hear a second?
I'll second it.
Motion is made and seconded. Further discussion? All in favor?
So who made that motion? Because I think Carol wanted to make it as well. Who made the initial motion?
Richard did.
Aye.
Dr. Bringhurst did.
Okay.
So all in favor? Aye, aye, aye.
Aye.
Very good.
500 on that.
I just want to give a shout out. I see Jen's on the phone call, our new staff
Hey,
assistant.
Jen.
Hello.
So, Melissa, the Household Hazardous Waste Day on May 2nd, I assume, or?
So
did I
I'm not
assume
making
we're
a
gonna-
call quite yet. I think I
Okay.
told you guys the Medfield, they did cancel theirs. Theirs, however, was April 2nd or the first week in April. So I feel like we're still a little ways out. However, I'd like to have a decision probably within the next week or so. So
Okay.
probably
That's
leaning
fair.
towards we may have to postpone it, but I definitely will keep everyone updated with that.
All right. Is there anything else on the agenda that we absolutely have to deal with tonight?
I don't, Rika, do you think there's anything else?
No.
All the other meetings have been canceled. Are they still happening over Zoom?
Oh, okay.
As far as I know, I'm not 100% sure about that. So first, before we get kicked off, can we try to see when we want to meet again?
Absolutely. I mean, our next regularly scheduled meeting would be what, April 7th?
Next Tuesday. So I mean, I'd like to keep it weekly if possible, just to keep everyone in the loop. And if we have to make any decisions regarding closures or things along that nature.
Oh, absolutely. Yes. I think if nothing else, just a quick, 15 to 30 minute, touch base, see what's going on a weekly basis for at least the next several weeks. I'm perfectly fine with that.
Okay.
So that 31st, right?
Oh, yeah, because our next regularly scheduled meeting wouldn't be till April 7th.
Yeah. So let's do the 31st.
Yeah, absolutely. Let's do the 31st, 7:30. If it's 15, I mean, it doesn't even have to have unless there's something major that needs to be
the
on
only
the
thing
agenda.
is, like, we eventually do need to get through these agenda items. I just know that I believe we only have 40 minutes on this call, so I
Right.
believe where we started, I think around 8:53
Right,
might put us in as, so we might get cut off any moment.
Yeah.
So we could
And that's fine.
start getting into the agenda items if you'd like, and see where it leads us
Well, I
to.
mean, if there's something that we absolutely have to deal with tonight, yes. Otherwise, let's defer it till next week.
I
Yeah,
think
don't
it can all be
think-
deferred.
Yeah, I think it can all wait. So what I'll do is I'll send out an updated agenda, but we won't have any new items on it. So I'll just
All right.
email everyone the updated agenda, hold your current packet, so then that way you can reference the documents that we haven't gone over tonight.
Sounds
Okay.
good.
Okay?
Mil- You said you were gonna, like, because I requested those to be mailed, like, whatever
Yeah,
edition.
so I'll mail, but in this case, I can still mail it, but it's just gonna be the agenda update. It's not gonna be any other documents.
Because I didn't receive anything for tonight's meeting, so like, just
Could
the,
have. It just might be the mail, because I know a few people did and a few people didn't. But yeah,
Right.
so moving forward, so is there anyone that does not want their packet mailed to them anymore?
I'm fine getting it by email.
Rachel, Bill,
mine.
Yeah, I'm fine with that.
Carol wants hers mailed, Mona wants hers mailed. What about Richard and Rich?
You can
It
email
would look better
Richard.
for me if I could get it through the mail.
You like it through the mail, Rick? Okay, and Stefan?
I hate the charge.
I think Stefan said he would like his emailed now too. Okay.
Yep.
And then last
Email's
but very
perfect, thank
not least, so Karen's on the call right now. So Karen is not renewing as an associate member, but we just want to thank her so much for her time, for her support for the board this year. She has other things that conflict in the schedule. Karen, we'll let you say a few words.
Oh, no, this has been a great learning experience. Thank you very much. Unfortunately, they scheduled my online class starting in next semester, which is May, on Tuesday nights,
Oh,
7 to 9 p.m. So,
We could call them and have them change that, maybe.
I
Yeah?
know. I'm grateful that they're still going on.
Well, we thank you so much for your
Yeah, and that
Your
could change in
involvement
the
and
future.
participation.
Thank you very much. But
thanks.
since it's still March, I'll be here next week.
That's true. That is true.
All right, well, we certainly wish you the very best of luck in whatever it is that you pursue in the future.
Thank you.
and, by the way, Melissa, you know, my term expires April 1st. Were you able to, follow up with the selectman's office?
Yeah, so they did receive your paperwork.
Okay, so that we'll hear
You
something.
should hear, yes. Yep.
Because it happened one year where they didn't, it was April 1st and I couldn't attend the meeting. I mean, I could have, but
So Carol just said to attend the farmer's market this summer because Karen's a vendor.
Right. But it's not food, so I don't have to get a permit for my kitchen.
Okay, so we're gonna meet next Tuesday, the 31st at 7:30 via Zoom. Obviously, we'll make sure that there's no conflicting meetings, so we don't have an issue like we had tonight, and we'll start hopefully at 7:30.
Sounds
Okay.
like a plan. All right, everyone stay
We'll
safe.
close the meeting out.
Yep, we'll make a motion to adjourn.
I'll second
So
it.
moved.
All in favor? Aye.
Aye.
Good night,
Meeting is
everyone.
adjourned.
Thank
Everyone
you.
be safe. We'll
Thank
talk
you.
with you next Tuesday.